Hi, my name is Mr Marando and I'm a plastic surgeon based in the UK in South Manchester. Today I will take a couple of minutes to explain what the Mia Femtech breast harmonization is. It is a new technique based on a new technology which allows a breast harmonization with small implant with a different design positioned through a very small incision of 2 to 12 centimeters long in the axilla, so away from the breast per se, which makes the cosmetic result of the scar basically invisible. So a small incision in the axilla in a patient which is going to have a local anaesthetic and sedation. The local anaesthetic is injected all over the chest area, and the sedation will be more or less depending on the level of tolerance of the patient and the patient preferences. Once the patient is comfortable and the incision has been positioned high in the axilla, this device, which has been designed by Mia Femtech, is introduced slowly to create a tunnel which comes all the way down to the center of the breast. Once the tunnel has been prepared, a second device is introduced. This device as well is atraumatic like the previous one, and this device will follow the previous tunnel, and once it is positioned exactly where we want to allocate the implant, it is gently inflated from the outside. This stretches the tissue, the breast tissue, with a way which is minimally traumatic on the tissue itself and on the breast tissue in front of the muscle. And this is going to create a nest. The nest is where the implant is going to be positioned. Once the nest has been created, this device is then removed and gently extracted from the chest, and then is the time for the implant to be injected. Now, this implant is very different from a traditional implant. Inside there is something which is called super silicons, which are quite soft but actually are able to maintain their shape, and they are deformable in the position or when it is actually positioned through the small device which is the injector. The other difference is that as this implant is biconvex, so it's the shape of a diamond, this implant doesn't have a top and a bottom. And if this implant is compared in terms of projection to a traditional implant of the same size and projection, this implant gives 22% more volume or more projection to the breast itself. The design of this implant is very different from the traditional breast implant. Traditional breast implant has a base and has a top and has a dome. This implant has a shape which is biconvex. Biconvex means that the implant is the shape of a diamond, so there is not a top and there is not a bottom. This implant is injected using this device, which is the injector of Mia. So the implant is positioned inside here, then this is connected, and then this nozzle is then positioned through the same little tunnel and is going to inject the implant allocated in this nest here. At that stage, this is going to be removed, and there are 1 or 2 small stitches high in the axilla, a little bit of glue, and the surgical procedure is finished. And this is the Mia harmonization from Femtech.